Hello, Dr. David Kulla here with Synergy Wellness in New York. We have a young lady here who has Facet Syndrome, okay? So Facet Syndrome, I'm going to show you a picture of what that looks like, but Facet Syndrome is a postural imbalance that creates the lumbosacral joint, the lowest part of your back. It puts it into hyperextension. I also call it duck butt posture. Don't Google that. There's no such thing. I made that up. But duck butt like this. So your butt's sticking out, and what happens is your pelvis tilts forward. It's also called lower cross syndrome, right? So lower cross syndrome is just another term for Facet Syndrome. Lower cross syndrome is anterior pelvic tilt. And what happens is when your butt comes out and your pelvis tilts forward, your upper back comes back this way, and it puts your lumbosacral joint into hyperextension, creating Facet Syndrome. So that's what she has here. We're going to show you how we treat Facet Syndrome and the stretches, or the best stretch for Facet Syndrome. So if you have back pain after you've been sitting for a long time and you get up, it's kind of hard for you to straighten up a little bit and get all straight. This is why you have Facet Syndrome, okay? So again, if you're sitting for a while and you stand up and it's hard for you to stand up straight, that means you have Facet Syndrome. Okay, so what we're going to do is some flexion distraction technique for her. And what you'll see here is I'm holding the spine in place, and I'm taking her whole lumbar spine out of hyperextension. We're kind of putting it into flexion, hence the name flexion distraction, the name of the technique. And it looks really gentle. How's that feel? And again, this is taking that lumbosacral joint out of extension, and then we're going to go in and adjust afterwards. Now, this technique is not just used for people with Facet Syndrome. Anybody with a degenerative disc, spinal stenosis, pinched nerve, sciatica, bulge disc, this technique can be used really for just about any kind of spinal condition. How are we doing there? Good? Yeah. Okay. So right now she's just feeling a good stretch across her lower back. And for some of you that don't know, facets are the joints in the spine, and each vertebra has facet joints, a pair of facet joints. Now we're going to go to the other side here. You guys will be able to see a little better. So the vertebra, each vertebra in the spine has a facet that connects to a pair of facets that connect to the vertebra below it, and a pair of facets that connect to the vertebra above. As I said, those are the joints in the spine, and there are a lot of nerve endings in there. So what we're doing here is opening up the facets. So right away she should feel like it's easier. You okay?
Yeah.
Good. She should feel like it's easier to stand up straight. And then I like to use this machine right here to loosen the muscles up. So I take it you didn't dress up for Halloween this year?
No, I didn't.
Okay. I was going to be a chiropractor this year for Halloween, but just figured that was too easy of a costume. See, as you can see here, I'm very original.
Yeah.
Okay, so folks, you'll see here I have her lumbosacral joint, the very bottom joint, is in hyperextension. So I'm going to take the sacrum and drive it down and open that up. Take that lumbosacral joint out of hyperextension even more. We also did that with the flexion distraction. Okay, bend your knees. Take a deep breath in and blow out. And on your back. And I need you to slide down a little bit for me. There we go. Okay, cross your arms in front of you. almost like this. Yep.
Why do I always get it wrong?
Oh, it's all right. As long as I remember it, we're good, right? Yep, big hug, tuck your chin, deep breath in, come up. Good, I got you. And blow out. Okay.
Sorry, I forgot my ponytail holder.
No, it's okay. And relax here. And it's your real hair, so, you know. A lot of ladies come in with
The fake,
yeah, so no need to apologize. Okay, stand up here. I want to show you the exercise or the stretch.
Okay.
So this is the best stretch for somebody with Facet Syndrome or lower cross syndrome. It's very simple. It's this. So you grab your ankle behind your knee. It's the runner's stretch. So go ahead and try that. You can't. That's okay. So what you'll do is you'll do it on your side, right? You'll lay on your side like this.
Yeah.
You'll reach for your ankle this way and do it
pull
this
it
way.
back.
Yeah, so for those of you that are unable to stretch your leg, you can do it on the side or standing like this and bring your heel to your butt. That's the stretch you want to do if you have Facet Syndrome, if you have pain after sitting for a long time and it's hard for you to stand up straight. So you can see here, this is a great stretch. Her partner's helping her stretch. She's not able to grab her ankle and pull it behind her leg to do that runner's stretch. So if you can't do that, you just do it this way, lay on your side and have your partner just push the leg into the hip and stretch that quad. Now another way we had just come up with, if she's lying on the couch, she could wedge her foot in the back of the couch in the cushions so that keeps her leg bent. And so she could do it on her own without any help. But this is the stretch that should be done for Facet Syndrome. Another stretch is a hip flexor stretch. And all of you guys, you know that. You just do a forward lunge like this.
Yeah.
And stretch out the hip flexor along with the quad. All right?
Thank you.
All right, guys. If you have any questions, comment below.